Two things define you: your patience when you have nothing, and your attitude when you have everything. Hello and welcome all of you to Meet the Masters. And today, the Medibis TV camera crew is at the premises of Siders Jebel International Hospital, and I am in conversation with their chairman and managing director, Dr. Adnan. Hello and welcome to the show.
Hello.
Well, my first question to you is, tell us something about the Siders Jebel International Hospital. We would like to know all about the hospital as a whole.
Initially, I was having my private practice in Dubai, and this area was simply coming up in those days. And the idea came to put up a clinic, basically, in the Jebel Ali area. So we have put up a polyclinic. It was in 1999, really, that it was, the construction was finished in 1999. And then in 2004, I got a hospital transformed I got a clinic transformed into a hospital. It's a multi-specialty hospital. We started with 20 beds, and we had a lot of changes to carry out in order to transform it into a hospital. And now we are going into another 100 beds.
Tell us something about yourself. We'd like to know all about Dr. Adnan.
Well, I'm born in Lebanon. I did my elementary and secondary schooling at a French college in Lebanon called St. Joseph College. I got admitted to the Johnston Medical School in Detroit. However, due to family circumstances, I found myself in Karachi. Don't ask me why and how, but that's what happened. Okay. In Karachi, I did my MBBS at the Doe Medical College. And then after that, I joined the Jinnah Postgraduate Medical Center for a specialty in internal medicine. I did my thesis on cor pulmonale, which is the cardiac conditions that are caused by pulmonary conditions. There was a requirement for 25 rare cases to be done. After that, once I graduated, I was appointed as the medical advisor to the UAE embassy in Karachi. Mm-hmm. And I was at the same time tutoring postgraduate students at the Jinnah Postgraduate Medical Center, where I finished by being unofficially as an assistant professor, because I was a foreigner. After that, I got an invitation, let's put it that way, to come to this country from the old dear friend who was the Consul General of the United Arab Emirates in those days. Mm-hmm. And that's how I came in early 1981, 1st of February, 81.
There would have been nothing here when you arrived.
Absolutely, absolutely. I mean, the frontiers of Dubai were up to, if for people who know Dubai, they were up to the municipality building or the Sheraton Hotel in those days. So you can imagine the massive transformation that has occurred since then. Yeah.
Well, tell us something about the specialities of the Jebel International Hospital.
It's basically, it was conceived to be, as I said earlier, to be a polyclinic to serve the industrial area, the nearby industrial area, the Jebel Ali Free Zone industrial area. And it has served this purpose for 5 years initially, and then it was transformed into a hospital. Considering that in those days there was nothing of the developments that you witness today. There was no, for instance, there was no gardens, there was no discovery gardens, there was the only residential area was the Jebel Ali village in this region. The rest was absolute desert. There were few hotels, beach hotels in the marina. So we came up initially with the concept of having a community-oriented hospital, right? Or what is termed in medical language as a secondary care hospital. So we started a surgery department then, because for a surgery department you need to have inpatient and you need to have therefore a hospital. So we have a general surgery service. We have an endoscopic and laparoscopic surgery service. We have a department of medicine, cardiology, limited department of cardiology, limited department of gastroenterology. We have pediatrics. We have practically, we touch to most of the specialities of the hospital. However, that is till a certain extent. That is the reason why we are expanding now to go into what we call in medicine a tertiary care setup. A tertiary care setup is a setup where any medical conditions can be treated in the place itself. And this is what we are right now doing. We are expanding into a 100 beds hospital, 104 beds hospital, and it's going to pave the way. We are just paving the way to a university hospital, okay, teaching hospital. And this has arisen out of a need, basically. In the good old days, you see, you needed only to have the intention to go for a specialty in Europe and you were admitted. Today, with the advent of the European Union, well, priorities have changed. The priority is given to the local citizens of that particular country, whether it's in Europe, whether it is Germany, France, or UK, or any other. Then the second priority is for the European community, citizens and members of the community, European community. For this reason, it became difficult for people coming from the third world to obtain a specialty, really, an internationally recognized specialty. So we went into understandings with German universities, and now they asked us, okay, you build and we will come. And this is what we are doing at this point in time. Because otherwise, you see, this area will always remain a consumer of medical know-how. And it's time, I believe, to think in terms of transforming it into a medical producer or producer of medical know-how. And this is the only way to do it. I never had the intention of adding another hospital to the range of hospitals that exist in Dubai. It doesn't make sense for me. I don't like to go into what you call the healthcare market competition and all that. I'm not a business-oriented person. I am a doctor, a hardcore doctor. Okay, so for this reason, either one makes a difference or not. And the only way to make a difference is quality, to go into a quality setup. Now in medicine, what is a quality setup? is to succeed where others have failed, to answer questions that others could not, to make the diagnosis that others could not diagnose, to treat the cases that were resistant to treatment or were had a primary failure or secondary treatment failure elsewhere. Okay, that's how you make a difference. And I know a lot, for instance, about Indian medicine or generally the medicine in the subcontinent, and I think you have in there succeeded in creating such a setup.
Well, we would now like to touch a falcon's eye view to internal medicine, because recently we've been hearing about the Middle East respiratory syndrome, which is a serious threat to the entire community of human beings living in this part of the world. So we'd like to know as to what is the so-called MERS virus or the Middle East respiratory syndrome virus?
The Middle East respiratory syndrome or MERS is a syndrome caused by a virus. It's a virus infection. It is transmitted through the air. However, there has been, but where from it comes really, there has been a debate. Certain centers, research centers, have said that it is communicated by camels.
Camels.
Yep. Yeah. However, there is absolutely no confirmation of facts as to the relationship. Now, the circumstantial relationship or the environmental relationship make the supposition, the assumption plausible, right? Because it's happening in a certain area, it's happening in Saudi Arabia. And you might ask me by saying, okay, there are camels elsewhere, why did it happen? Well, since it is a viral infection, it affects a certain being in a certain locality. You can't say why such a virus infection has happened in China or such a condition is in India. Of course, there is a geographic distribution of disease that is helped by genetic as well as environmental factors. Fine. To be specific, this is a viral infection. To address, it is mainly concentrated, most of the cases have been found in Saudi Arabia, and the cases that have been found diagnosed outside the Saudi Arabia, they were in the surrounding countries, be it in Jordan, there was one case in Lebanon, one case in Syria. There was an announcement of a case, but no death in the UAE. However, in Saudi Arabia, well, the condition, I mean, when you speak of 200 and more than 60 cases since 2012, it started in 2012, as a matter of fact, in Saudi Arabia, and now you're dealing with a problem. Okay, the name of the virus is called the coronavirus.
Okay, coronavirus.
Yes. Now, how to treat it? As a matter of fact, there is no treatment.
There's no treatment?
No. There is no treatment. You treat the symptoms. How do you suspect it? Well, it presents like any other flu. Okay? It presents like any other flu. Now, how do you suspect it? Okay, you're not going to suspect every patient with a flu. However, the clue is in these conditions, which is not so much spoken about in the media, and that might put the minds of people at rest and reduce their anxiety a lot. People who have the respiratory system, along with a relative renal insufficiency, should be suspected. Otherwise, okay, you test for the virus and you confirm the presence of the virus. Okay. So far, there isn't a vaccine.
To curb it.
To curb it. Laboratories are working hard on developing a vaccine. But no vaccine has
been
developed so far. Now, how to prevent it? The recommendations are the simplest thing on earth. Hand washing with soap, repeated hand washing, frequent hand washing with soap. avoid coming in contact with a patient, not try not to be intimate with the patient, avoid his mixing of the clothes, of the utensils which are used for food, etc., etc., bed sheets, and so on and so forth. You know, these are the preventive measures that one can take.
Well, being in the media industry, we have got information from reliable sources that you are a poet and you have a passion for collecting classic cars. So we'd like to hear from the horse's mouth itself on the collection of classic cars and your poetry aspects as well.
Well, regarding poetry, I usually don't announce myself as a poet, nor do I ever claim. However, yes, since you did your research
investigations,
and did your detective job very well, I'd like to tell you that, first of all, poetry is not something that you can acquire. It's inborn.
It's inborn.
It's inborn. And how does one become a poet or not? That is anybody's guess. I mean, either you are or you are not. Okay. However, in poetry, it is your relationship to the world that you are living in and your reaction and interaction with this world. It's your interaction and reaction, as a matter of fact. There are people who feel the surrounding that's around them and responds and react, okay, with feelings, thoughts, etc., etc. And there are people, okay, who pass in life and leave no print. Mm-hmm. Okay. And that's the largest majority, as a matter of fact. So poetry for me is life. It's my internal life, as a matter of fact.
It's a passion for you.
It's my internal life. It's more than a passion. It's my way of expressing myself. Mm-hmm. It's a way of localizing myself towards the universe, mm-hmm. in terms of thought, in terms of religion, in terms of philosophy, in terms of sociology, in terms of psychology, in terms of existence, as a matter of fact. Mm-hmm. Okay? And I live it. I told you, I can't find a better expression than saying that it is my internal life. Okay? Or my spiritual being. This is my spiritual being. This is how I express my spiritual aspect, if you wish to say, or that spiritual part, an essential part of myself. Regarding cars, well, it's something that goes to childhood, you know. Whenever I was presented with a car by my parents, I used to break it down. And when my mother used to give me a shouting as to why I'm doing this, I used to say, well, I used to lisp, and I used to say, I'm repairing it.
You're repairing it.
Yeah. And I went on repairing cars. Okay. Now, classic cars, again, you know, for me, it's not simply a machine. It represents a legacy.
Of course, of course.
Okay? It represents a history. It's not just a commodity that you use and throw away. It acquires a soul. Mm-hmm. So you see, that's how poetry and the cars go together. It's from within the same concept. There was, you might ask me also, did you ever write on health matter? Well, health matters are human matters. Mm-hmm. I wrote about people's pains, about people's sufferings, about people, whatever. I mean.
So you should have a huge collection of both poetry as well as cars as well.
Poetry, yes. Cars, I have 3 classic cars.
Classic cars. Well, with this huge hands of experience in this part of the world and several parts of the world as well, could you talk or could you tell us about the rare cases of medicine that you've dealt with?
Well, in terms of rare cases, what may be rare in a part of the world may not be rare in another part of the world, but I'll try to speak of rare cases in general in medicine. And for instance, one of the rarest cases that I've seen in Dubai was a condition called thrombocytopenic thrombocytic purpura, or called TTP, where there is where the RBCs break down and they cause clotting in the arteries, and the rate is extremely, extremely rare, and the recovery rate is not more than 3%. So this is
3%?
Yeah, recovery rate. I mean, otherwise 97% die. The other interesting conditions that I've come across, they're not rare, but they were significant in terms of diagnosis, like cases, for instance, of depression mistaken for a panic syndrome, or depression, diagnosed case of depression while the case is a case of hypothyroidism. I have seen another rare case of pheochromocytoma, for instance, of 8 centimeter, which is, it was 3 years ago in a German citizen. It was a surprise to all of us. I've seen cases of cardiac asthma that have been initially diagnosed as bronchial asthma. I've seen cases of thrombocytopenia that were due to exact viral infections. I have seen cases, advanced cases of infective mononucleosis and so on, cases of myasthenia gravis. All these cases, you know, are pretty rare. What I have always, the attitude I have always adopted, never to say, I know it all.
Oh.
Always, okay, what next it could be, what else it could be. And that's how I could diagnose those rare cases, that's it.
Well, doctor, being a veteran, being an industry expert in your relevant field of the so-called healthcare, what is your expert advice or your advice in interns to the youngsters or to the other sectors of the society on healthcare?
You're touching to an essential question. Advising the young generation is a part of conceiving the society as such. And we happen to live in a world today where everything obeys the capital growth. And what applies on economics, what applies on financials, what applies on political systems, what applies on modes and styles of lives, applies on healthcare. Before we ask what advice can we give to the younger generation, we should ask ourselves about the reasons that led the younger generation into such a situation. Be it, for instance, drugs, be it other addictions, be it neglecting their health. You see, nobody would go out of the way, or even the most ignorant people would neglect their health willingly. All right? We have to consider what are the outside influences. I don't think you will raise your child, or anybody would raise his child at home, teaching him how to harm himself.
Not really.
Okay? So, one should find what are the social effects. One of those effects, you will find them in the course of life. It has become an extremely rapid, competitive course. We are in a constant, the generations today are in a constant race with the others and with themselves. So it's a whole psychology, it's a whole culture that has been formed around a certain basic life course and system, as a matter of fact. which was not the case. It wasn't the case. It's not the case with a peasant who is singing while plowing his field, or you know what I'm talking about. We're talking about a completely different setup today. Mm-hmm. And it's understandable, that the younger generations fall prey to this system. It's a world system. And the unfortunate part of it, that everybody is towing the same lane. This is one thing. The other example, internet. Now, it causes a problem to the patient and to the doctor. If you go, just to give you an example, if you go to an internet site today and say headache, most of the site will drive you crazy, because most of them will say a tumor in the brain, while it is the rarest condition. So it's another factor of stress. Mm-hmm. And then you see our system of values, social values and human values, is absolutely corrupted. Okay? Do we know who we are really today, in this globalized world today? Do we know who you are? You are an Indian. I am an Arab or a Lebanese or whatever. Okay? But what is there in our identity, okay, that we are keeping, while everything else is there to destroy everything that's there? So, regimenting humanity is not the answer, right? Going to the roots is the answer. So, this is my answer.
Thank you very much for having us on our show. It was a pleasure talking to you.
It's been my pleasure.
And absolutely a lot of information is being shared, exchanged. And we look forward to see you in the coming years. And we wish you all the very best to visualize the 100-bed hospital execution.
Thank you very much.
Oh,